So my goal with IKT is to introduce psychedelics to this community, starting with ketamine, but do it in a way that it's safe and that it's effective and it's backed by science. Ketamine, FDA approved in 1970 for general anesthesia. It's widely used in the emergency room, in the operating room, used every day. It's on the World Health Organization's list of essential medications, including penicillin, morphine, so it's used every day. In the 90s, we found that at low doses, it's very effective for mood disorders, for pain, and a whole host of mental disorders, including OCD, ADHD, substance abuse, you name it. Obviously, much different from traditional antidepressants. So it's different in its mechanism and it's different in how it's used. Not about taking a pill every day or taking ketamine every day. It's really using it as a reset. That's the way I'll explain it to my patients. A lot of the antidepressants, what they do is they treat symptoms, right? And that's why you take it every day. But they don't really solve the root problem. Ketamine, it acts like a reset, and that's what the science shows. The buzzwords are neuroplasticity, neurogenesis. What that means is repair of injured nerve cells that were damaged from stress, from age, from trauma, and a regrowth of new pathways. And this is where the psychotherapy is super important, because now that there's new pathways, a second chance, this is where you need to incorporate psychotherapy and actually make changes. Otherwise, patients are going to fall back into the same behaviors, same negative thought loops, and it's going to do no good. It's going to be just an experience, just a dreamlike experience for them, but not something that's going to stick. So I always think of ketamine as really a lubricant for psychotherapy. The ketamine in itself will have positive effects. People do feel better. They just feel less anxious. One of the FDA indications for ketamine is acute suicidal ideation. So it works very, very well for people when they're at their worst. But we want to take it a step further. And that's pairing it with the psychotherapy. So this is a durable, long-term deal for these patients. As far as the indications, there's 3 broad categories. Medical use, and that includes people who want functional improvement with regards to pain. We treat a lot of pain patients, and honestly, they're some of my favorites because they're the ones who struggled the most. They're the ones who've been on opioids, who've had surgeries, who've had physical therapy, pain specialists, and they're at their wits' end. And ketamine works. It works really, really well and really fast. So that's one broad indication. The other one, obviously, is mental health. Depression, anxiety, PTSD. And then there's this gray area as far as enhancing daily life for the healthy. And I'm all for that, to be honest, but it is risky at this time because it's against all FDA, and it's just against all rules, right? But having said that, we've treated patients who suffer from mental illness, but they're also artists or they're musicians or business people, and they found improvements in those avenues, which is awesome because they came in for one thing and they came out with a whole, feeling a lot better or doing better, performing better in so many different ways. The beauty of ketamine is it is very safe. When I was a trauma surgeon, I was very comfortable with it, and I chose ketamine versus the opioids like morphine because it didn't affect respiratory drive, it didn't affect hemodynamics in regards to heart rate, blood pressure. So it's a very safe medication, but there is some elevation in heart rate and blood pressure, especially if they're having an emotional response, because this is a very emotional experience for a majority of people. So that's to be expected. We monitor patients and we're able to treat them if we need to. We have all the medications. I've never had to. Nausea is a concern, and it's more of a concern at higher doses and with visual stimulation. So ketamine will cause nystagmus, which is basically the eyes just kind of quivering, and that will cause nausea for sure. So that's why we wear eye shades, and we wear it for 2 reasons, because we want to avoid nausea, but also we want people to focus inward. So when they're seeing things, they're focusing on everything and they're kind of ignoring what's the real purpose. So if you wear the eye shades, you're going to focus inward, and I promise you, you're going to see much more beautiful things than anything in a room. So that's why we use the eye shades for nausea, but also to get the most out of these experiences. Cystitis, you might hear about bladder injury, and that is definitely a concern, but that's with abuse. That's with daily high use. So never going to be a concern here in the clinic. Addiction, some people say this is not addictive. That's false. So it's not physically addictive. No, you're not going to have withdrawal, certainly. But yeah, if you're getting this delivered to your home, it's going to be far too easy to take it every day. But there's a whole host of businesses where they will ship ketamine to your doorstep. And it sounds great in the comfort of your home, but there's no preparation, there's no intention setting, there's no guidance, there's no monitoring, and there's no control really. And by control I mean what's to stop somebody from taking it every day. And that's not how ketamine should be used. It's a beautiful medicine that should be used sparingly when you need it and when you have a lot of preparation. Right? There's people who want a magic pill, or they're not willing to do the work with the psychotherapy, not willing to do the work outside the infusions. So we always encourage people to get those things in order first. Come in when you're ready. Come in when you're willing to do the work. Our process starts with either a referral from a provider or just a simple Google search. And then they book a consultation with me, and I speak to them. And the purpose of our first conversation is, number one, to medically screen them. Make sure this is safe for them. Make sure there's no contraindications. Educate them. Make sure that they understand the process. Set and setting is a huge thing for ketamine and psychedelics. So they need to be very comfortable with the process, with the physical environment, with the team. And then I encourage them to do more homework. Read about this. Talk to loved ones. Talk to your therapist. Talk to your healthcare team. So it should be something that should be thought about over a course of weeks, months, however long it takes. There's no rush. Then they talk with Cindy. Cindy is our therapist. She does the biosocial screening, and then she does the first appointment. So it's a series of 6 infusions, but prior to that, it's a first therapy session with Cindy. And her role is to prepare everyone for these infusions. Again, set intentions and give them tools to go home, tools when they're spiraling, when they're having a hard time with anxiety, depression. That includes meditation, that includes mindfulness. This is a team effort. It requires a lot of integration with Cindy, the therapist, but also other people in life. Talking about it is really going to make things stick. The patients who are willing to do the work, who do the therapy, who make the lifestyle changes, it lasts much, much longer. And they may never need an infusion again. So people usually have 1 or 2 experiences. One that may feel very meaningful, meaning that they have a lot of insights, memories, they see people, motivation. Other times it's just random and weird. It definitely does have psychedelic properties. Sometimes you see colors, have sensation of movement, which can be enjoyable or it can be scary, but I always tell people to separate what we're doing as far as infusions and the healing. So they're 2 separate processes in my mind. We make it as comfortable as possible as far as infusion, but the neurogenesis, the repair of the nerve cells, regrowth of new ones happens hours, days afterwards. So I always remind people, if this is random or weird, or you don't know what this meant, that's okay. Some common themes. This is often described as a very mystical, spiritual experience for a lot of people. Some people say it's the most profound experience they've had, just alongside the birth of a child or a marriage. So it can be pretty emotional. Majority of people find it very enjoyable, very relaxing, but sometimes they can be challenging. I don't like the term bad trip. I prefer challenging because a lot can be gained from these challenging experiences. The medicine will show you what you need to see versus what you want to see, but sometimes it's scary. Scary things come up. I always tell people, approach it with curiosity. Don't run away. Just see what that means. See what that turns into, because often it does turn into something that they can take home or use. This is not covered by insurance, not FDA approved, not anytime soon. So it's difficult for a lot of people. Access is a challenge for a lot of people. What we can do is produce super bills. I'm sure you guys are aware about that. We've had some luck with that. We also have a payment plan, but we're working on ways to improve access.